Good morning.
Let me introduce my patient, Mrs. Lakshmi Piris, a 52-year-old mother of 3 children, presenting to us from Pirian. Her presenting complaint is abdominal uterine bleeding. Why I call it abdominal uterine bleeding is her cycles have been regular until 10 months ago. And she was menstruating every 28 days and it lasted only for 5 days. She used only 3 pads a day, which was semi-soaked. However, for the past 10 months duration, she has had regular cycles with heavy menstrual bleeding. Her cycles were still 28-day cycles and she was menstruating for 5 days. Her flow has increased with associated clots and flooding. She had been using 5 pads a day, which were fully soaked. However, with this heavy menstrual bleeding, she has not had intermenstrual bleeding or postcoital bleeding. She has had pain associated with menstruation, which was confined to the duration of menstruation. She had not had premenstrual pain or postmenstrual pain. There was no deep dyspareunia as well. For this problem, she has sought medical treatment in December, 4 months ago, where she has undergone an ultrasound scan, of which the diagnosis she is not aware of. She was also she has also got admitted and undergone a dilatation and curettage, and she was reviewed in reports after 2 months duration. She is not aware of the diagnosis. However, she was started on norethisterone 5 milligrams a day, 5 milligrams 3 times a day for 3 months duration. She had been compliant for this medication as well. While on norethisterone, in April, she has started menstruating again. It was continuous as well as it was with the passage of mild amount of bleeding with no passage of clots or flooding. And then currently she is admitted to the ward to undergo a hysteroscopy. And she has a diagnosed patient with dyslipidemia for 10 years duration, and she is a diagnosed patient with hypertension as well. For both, she is on medical care and she is being followed up at a medical clinic. Both these diseases are well controlled, and she has undergone screening for microvascular and macrovascular complications as well. She has been screened for ischemic heart disease, and she has undergone 2D echo just 1 month ago, which was reported normal. She is on aspirin prophylaxis, and following that, she has developed she was found to have a goiter as well. She has undergone an ultrasound scan and a FNAC biopsy of the goiter, and she has been screened for thyroid function as well. All were reported normal. However, that was several months ago. Currently, she is clinically euthyroid as well. She doesn't have a significant past surgical history apart from dilatation and curettage, and she is not allergic to any drugs. Her past obstetric history is unremarkable. She has not had any antenatal. All 3 children were delivered vaginally. No significant complications in the antenatal or postnatal period. However, sir, she has not, until now, she has not been on hormonal contraceptives or intrauterine contraceptive devices. Currently, she is not having any perimenopausal symptoms as well. She doesn't have vasomotor symptoms. She doesn't complain of any urinary or sexual dysfunction. However, she is not active sexually for the past 10 to 12 months duration. Currently, she is not registered at a well woman clinic as well. She has never undergone a pap smear or breast cancer screening. According to my history, sir, I have assessed her problem according to the Palm-Cohen classification, and there are features to suggest an endometrial polyp, possibility of endometrial carcinoma, and possibility of endometrial pathology as well as iatrogenic due to the treatment with aspirin. And currently, she doesn't have any symptoms of anemia. I have assessed the impact on her quality of life, her activities of daily living, her sexual function, as well as psychological and social functions are not affected by the current problem. However, she wants to know whether this has a possibility of turning into a malignancy. She is willing to undergo conservative management with being compliant to her follow-up schemes as well. However, since the family is completed and she's perimenopausal, she is willing to undergo hysterectomy as well. She's currently working at a small-scale garment factory as a seamstress. She earns about 35,000 rupees a month. Her husband is a driver who earns about 40,000 rupees. All her 3 children are educated. Her eldest 2 children are occupied, they are independent. However, they are not married, living with the patient. The youngest child is sitting for A-levels this year. They live in their own house, and if she undergoes surgery, following the surgery, sir, she has family support by her children. She is able to travel and visit the clinic also regularly. Following my history, sir, my patient is a 52-year-old mother of 3 children, who's been diagnosed with hypertension and dyslipidemia, who's having good control, and who's diagnosed with a goiter as well, with currently clinical euthyroid, presenting to us with abnormal uterine bleeding for 10 months duration, who has previously undergone dilatation and curettage as well, but still being symptomatic. So following my history, I have come to a differential diagnosis where there's a possibility of endometrial hyperplasia as well as endometrial carcinoma, and the bleeding could be caused by aspirin treatment, as well as there's possibility of thyroid dysfunction as well.